Hi, my name is Catherine Conway. I'm a student in Dr. Carson's pharmacology and addiction theory class. So I am doing Klonopin, talking all about this drug that is used mainly for anti-anxiety, for sleep disorders, and seizures. So it has a lot of interesting properties that make it unique and specific. It is a benzodiazepine, so that is the class, and the schedule is oral typically. It's most commonly used for panic disorder, and that will start off for twice a day for 3 days at a dose of 0.25 mgs, and then after 3 days the patient typically gets moved up to 0.5 mgs twice daily. However, I also was reading that because it has a short half-life, sometimes it's prescribed as needed. It is a very highly potent drug with a long-acting manner, and clonazepam is another common name for the drug as well. So the half-life is 18 to 50 hours, and that's actually a short half-life for how long it stays in our system or anybody. And so it peaks at 1 to 2 hours, which is very fast acting, which makes it a highly addictive, actually the most highly addictive in its class. So it's a very highly addictive benzo because you can take it quick and it has that effect, boom, like right away almost. So it's always going to be swallowed, but it can be injected. It's typically swallowed. Signs of acute intoxication include things like acting really slowly, mental confusion, lack of coordination. Sometimes it can lead clients to depression, irritability, numbing out their feelings, so they're not feeling at all, and I guess emotional numbing. So in older people, dementia can be worsened when they're really kind of high, intoxicated on it. So just really being like dizzy. It just seems like I get the image of somebody really sleepy and stumbling around if they're intoxicated on Klonopin. And with withdrawal symptoms, that's going to be kind of the opposite of the calming effect the drug has. So that's going to lead to insomnia, increased heart rate. It's going to look different, of course, with everybody, but a long list could be seen with things like headaches, stomach pain, nausea, vomiting, tremors, short-term memory loss, insomnia, I think I said, sweating, increased blood pressure, dizziness, fatigue, muscle spasms, cramps, diarrhea, feeling lightheaded, seizures. Oh my goodness. So it's really just the opposite, it sounds like, of the effect that the drug creates, which is probably makes it really difficult for somebody to possibly get off of it, I would assume. So the treatment for these withdrawals is going to be varying, of course, like everything. But medically, the treatment is going to be given some medicines such as an SSRI like Prozac or Paxil. Some people are going to need anti-convulsion medicine. Like I was saying, seizures is a withdrawal symptom. Melatonin can be helpful to help with that insomnia that can be created. So a lot of different symptoms can be addressed with medication, actually, but therapeutically with treatment in a therapeutic setting, that's going to be, of course, like CBT, the typical stuff. Motivational interviewing is common. Group and individual CBT can be effective to teach clients how to avoid stressors, how to respond when they're triggered, and to just talk that out and start getting support to implement and practice that in their everyday world. There also always needs to be peer and family support because it always is a family disease addiction, like always. So relapse is, of course, common, and it can be hazardous after detox. Sadly, there was 7,000 fatalities I was reading in 2013. So it's important to get that help that's needed when somebody is experiencing those withdrawal symptoms. And there is so many facilities in this area where I live in Richmond, Virginia. I'll get to that in a moment. But just moving forward here, the overdose potential actually is low when you're only taking the actual drug. When you're taking Klonopin, there's not a high risk of overdose. It actually usually occurs when it's being taken with other drugs, such as opioids, or if it's taken with alcohol. I was reading that alcohol is the most common combination of that lethal overdose. So it's interesting, the global rates say that 1% to 2% of people have taken benzos. I honestly had a hard time finding Klonopin in specific, but 1% to 2% of people have taken those recently, in the recent years. So 1% to 2%, and daily for 12 months or longer. So that's going to be in the more abusive range. But it's interesting that a lot of people that are addicted to other substances are also going to be addicted to benzos, such as 15% of heroin users take benzos daily, 73% weekly, 80% of people are going to be taking them that also take opioids, and a lot of that is just because that fast effect. 90% of methadone users take benzos as well. 80% of alcoholics actually have been addicted or used like at least one other drug in general. So just talking about that like co-occurring effect that happens with users. And so it's interesting that benzos really are most detrimental when they're co-occurring with another drug. So unfortunately, I had a hard time. I really looked for current rates of abuse in my state of Klonopin and benzos, and I was looking at a specific website. So I apologize. I was having a hard time. I'm not totally sure, but I'm gonna send that website on, and hopefully maybe we can figure it out together. So the whenever the treatment here, but moving forward, I was looking at the treatment options in our area. So I'm in Richmond, Virginia, and man, we're lucky that we have so much support. NA meetings all over the place, AA meetings all over the place. And then here we have, if you go to this great website, www.addictions.com rehab in Virginia, it's a huge list of facilities. And it also says what insurance that is accepted at each facility. So I was looking at New Life for Adults, Archstone Counseling, Applegate Recovery, Henrico Area Mental Health offers some rehab. Bon Secours, of course, we have a lot of hospitals here. Virginia Hospital Center, so looking at methadone clinics. So, I mean, Riverside Comprehensive. I mean, I would probably have to do a little bit more investigation. West Grace Health Center. So I'm assuming this could be a long list, but maybe it's not. I mean, I don't know what in comparison it is, but I was kind of happy when I saw like, wow, looks like a lot. But I'd be interested to see what happens once I start calling these places. So, moving forward with any intriguing information that I gathered, I thought it was interesting that with dementia patients, it kind of sometimes can take on some different effects with those patients. It can actually, with elderly patients, it can really just increase dementia. Not even when there is a intoxication effect, it's just the overall increasing dementia. I'm always curious about what contributes to dementia. I thought it was interesting how the drug metabolizes, so that and I'm not sure, I apologize that I even went over that thoroughly, but basically when you take a benzo, Klonopin, you swallow it, and it's a highly it has a lot of protein in it, and so it really evenly distributes in your body more so than other drugs that has that protein, I guess, substance stronger than other drugs. And then you basically, once it's in your GI system, it's going to start going to your brain, and then it's going to attach to the receptor, the GABA receptor. That GABA receptor is going to actually be more active as it sort of attaches to the GABA receptor, and then that's going to reduce the neurons that are taking place, the neuron distribution in the brain, which is going to create that calming effect. And that calming effect is going to be really helpful. So the person thinks to treating that anxiety, and that just if somebody's freaking out, it's going to be like that quick 1 to 2 hour effect that will take place, where the neurons are just like slowing down in the brain, everything's relaxing, the muscles are relaxing, and then it's going to be actually metabolized through urine every time. So it's going to be able to, you're going to just basically, it says almost 100% urine, what I read, and it's going to take, should pretty much completely leave your system once that full half-life is over. And I thought that was pretty interesting, actually, to think about kind of the half-life. It sounds long, but I guess it's not. And it sounds like... I thought, like, going back to the occurrences, I thought it was interesting, like, how it is actually not that dangerous by itself, but it's interesting to think about the people, like the different addicts that are already addicted to things like meth or heroin, or just opioids in general, alcohol, are going to be really likely to maybe reach for something like Klonopin because they're in an anxious state. So it was good just to think about that. I haven't thought about the co-occurring drugs and how that is really just a huge impact. I mean, I guess I think about it when think about overdoses, like, wow, they were on a lot of things, but I guess I just don't think about it specific to one drug. So that was cool. But all right, well, thank you so much for listening, and I'm enjoying the course. And I will say, side note, I apologize, this is not creative, and so just hopefully answering all the questions, and I can get you my sources later. All right, thanks for listening. Take care.